Good morning, all. I just read something a little disturbing and just proves my um, belief that ethics are lies. But before we start on this news story about hospitals giving out blanket DNR orders, please subscribe and uh, like my videos. On to the story. Hospitals waive blanket DNR orders for coronavirus patients amid equipment shortages. As hospitals across the country face shortages of personal protective equipment due to the surge of coronavirus patients, healthcare professionals are reportedly privately discussing the possibility of a blanket do not um, registrate policy for infected patients to mitigate the risk for those responding to the cold blue. If we risk their well-being in service of one patient, we detract from the care of future patients, which is unfair. Bioethicist Scott Halpern of Washington of University of Pennsylvania wrote in a circulated model guideline, according to the Washington Post. Still, he said blanket DNR's policy for all COVID-19 patient is too draconic. He suggests the patient's doctors and another should sign off on a case-by-case DNR order for patients, giving the reasons to the family, although they do not have to agree to it. Richard Wunder Inc., an ICU medical director of Northwestern, said that many families are choosing to sign DNRs when hospital staff explain that they have to put on protective gear before attending to a coding patient, decreases the chance of saving their life. By the time you get all gowned up, double gloved, the patient is going to be dead. We, uh, an ICU nurse in Michigan, told the Post, "We're not going to. We are going to be coding dead people. It's a nightmare. Doctors swear to do everything they can to save a patient's life, but as COVID-19 case surge, the shortage and necessary personal protection equipment are forcing medical profession into an ethical quandary." No, this is why ethics do not matter. Make it a law. Make it a rule. A hard, fast rule. Ethics you can bend anytime you want. If you can change your ethics like that, like they're doing now, did you really have it? Was it really an ethic? Uh, did it really mean something to you, or was it just something to sound nice? We are now facing difficult choices in how we apply medical resources, including staff. Louis Kaplan, the president of the Society of Critical Care Medicine and the University of Pennsylvania surgeon, said, according to the Post. When a patient codes, meaning they are gone into cardiac arrest, all available staff respond to the code blue to perform CPR and other life-saving measures. That doesn't help anybody if our doctors and nurses who by the are failed by the viruses are not able to care for us. A bioethicist R. Alto Caro, a University of Wisconsin-Madison bioethicist, said the code process is one that puts them in enhanced risk. That's the job. That's what they signed up for. Often dozens of masks, gowns, and gloves can be used in the process. It is extremely dangerous in terms of infection risk because it involves multiple body fluids, an identified ICU doctor told the Post. At George Washington University, they use a machine to perform compressions on the coded person, but since there are only two available and the contingency hospital staff will place plastic sheeting over the patient as a barrier before beginning CPR. From a safety perspective, you can make the argument that the safest thing to do is nothing. Oh, yeah, it's always the safest thing to do is to do nothing. Let the person die. But again, the right thing to do is try to save them. And you're just now proving ethics means nothing. This is why I hate doctors. They change the rules all the time to suit themselves. Oh, it might make me a little. I know I signed up to treat sick people, but I don't want to be sick, so I'm gonna let sick people die. This is just a death panel. They should come out and call it a death panel. This is bullshit. As always, everyone be safe. Have fun. Bye bye.